If you're prone for anxiety, panic, or stress, you want to avoid these supplements. Certain supplements can worsen anxiety. I'm Dr. Melissa. I'm a family, lifestyle, and integrative psychiatry specialist to share all things science and tools so that you don't do things the wrong way. Number 1, you want to avoid caffeinated supplements. Definitely caffeine can overstimulate the nervous system and make your anxiety go on overdrive till panic, sweaty hands, palpitations, and often get loose stools and headaches. So check your ingredients. Most pre and post workout supplements, shakes, powders have caffeine. Another example of caffeine is green tea extracts. If you're trying to lose weight, they often hide green tea in those supplements and powders or even sports bars. Number 2, guarana. That's actually stronger than caffeine. Definitely want to make sure to read those ingredients because you may be making your anxiety and panic attacks worse. Another one is yerba mate. Yerba mate is another caffeinated form that can be found in supplements, so make sure it's not mixed into the multivitamin that you're taking, because most of the time there's not just one ingredient but 5 or 10 ingredients, and it's hard to tell what's helping your body versus harming. So what can you do instead? It's important to not dehydrate yourself like caffeine does, but to give yourself hydration with electrolytes. You can also put some lemon, some fruit infused natural drinks that you make yourself because you know exactly what's in it. Put some peppermint in it and even some strawberries, which is my favorite, full of antioxidants. I love herbal teas as another way to help calm the nervous system instead of caffeine. Herbal teas are non-caffeinated. There's not other mixtures in there. I love loose leaf tea that you can find through chamomile and lavender to relax the nervous system. Number 2, avoid those stimulant fat burner supplements. These supplements are so tricky because they trick you to believe that you're losing weight, and it may for a day or a week, but it doesn't usually last. It often increases the nervous system and metabolism and also creates more anxiety and more palpitations. These supplements specifically increase the heart rate, increase the blood pressure, chest pain, dizziness, lightheadedness, and it's really uncomfortable. Instead of having fat burner supplements, try to have a whole food, plant-based meal with fruits, vegetables, beans, nuts, and seeds that's rich in fiber, antioxidants, and good healthy fat and protein. You don't have to be afraid of these foods because they are linked to reduce chronic disease, even obesity, decrease depression, decrease anxiety, and better blood pressure and weight. Number 3, you definitely want to avoid high-dose B vitamins, especially B6 and B12. So I always say, talk to your doctor and make sure that you know your B vitamin levels, your B6, your B12, and that you're not overstimulating. So make sure you get your genetic testing if that's something that you can get, which I do in my clinic. Oftentimes people have the MTHFR gene defect, and that's basically because their enzyme can't convert folate or B12 to get to the active form. And often you find patients with low B12, low folate, and even low homocysteine. So you want to be careful because over the counter they may sell a lot of methylated or non-methylated B supplements. And if you don't know your genes, you can be making your anxiety worse. So what to do instead? Stick to lower doses, take B vitamins in the morning, and ask your doctor to test you for this defect. Number 4, avoid L-Tyrosine and dopamine boosters. That's actually when you're trying to get pumped up with full of adrenaline, but you don't want that during a panic attack or if you're prone to stress and anxiety. You want a calming effect. So make sure you look at your labels, especially if you're in the gym or getting offered all kinds of nutritional supplements but not knowing what it is. So a lot of times the L-Tyrosine, the dopamine precursors are what pumps your nervous system even more. We don't want to pump it, we want to balance it. So if you're taking L-Tyrosine, I recommend that you would stop, but definitely consult with your doctor so that they know what you're doing. You can consider seeing your RD or naturopath, someone who is certified and knowledgeable about supplements. So avoid the L-Tyrosine, but you may try L-theanine, which is more calming so that you can relax your nervous system. Remember, L-Tyrosine can increase heart rate and panic and make you feel out of control. You want to do the opposite, and you can do this by taking L-Tyrosine to calm your nervous system, but avoid L-Tyrosine and dopamine precursors. Dopamine precursors are phenylalanine, and you want to make sure you read your labels for that one. Macunapurines is another precursor to L-Dopa, so make sure you're not confusing your nervous system and not just taking supplements to take supplements. Number 5, you want to avoid ginseng and adaptogens, or at least do it in caution with guidance and supervision. Yes, ginseng might help with focus, but also it can overstimulate the nervous system. Rhodiola is a great tool for an adaptogen to regulate your nervous system, but oftentimes people don't know when to take them. It's good to take them during the day if you're fatigued, but not during a panic attack. Maca root is also very activating. It gives energy, so you don't want to pump the body up with maca, especially if you're very sensitive to maca itself. You can try this in slow doses or just avoid it completely. Once again, ginseng and adaptogens can be great herbs, but it also can be energy and stress producing. You want to balance the HPA axis, which is the hypothalamus pituitary axis, and decrease the amount of cortisol that gets pumped out. Instead of those herbs, you can try something like ashwagandha. Ashwagandha is great for morning or daytime, something that can calm you just as well. Number 6, you want to be careful with high dose vitamin D with calcium. So often people love their vitamin D, which I do, but you don't always want to overdose it, especially if you don't even know your labs. When you have high dose vitamin D, it can also suck up all the calcium and make you want to twitch. And when your muscle twitches, that can be very nerve-wracking. What's a better alternative is vitamin D with magnesium. That's a great match so that your calcium doesn't drop in your system, in your intracellular spaces, so that you don't feel the muscle twitch. Number 7, very important to avoid MSG. MSG hides in so many products, sauces, foods that you get at the restaurant, and even drinks. Make sure you don't have this glutamate, so monosodium glutamate, which can be neurotoxic and confuse your nervous system into a panic or anxiety. Glutamate boosting supplements are also another important to avoid because that's similar to MSG. It's just another form of it. So L-glutamine for the gut may be helpful for that leaky gut, but not so much when you have anxiety or stress. And another one is N-acetyl-glutamate. Once again, that's a precursor to MSG and all the things that overstimulate your nervous system, so make sure you read your labels. Glutamate is an excitatory neurotransmitter, so you want to be careful if you're feeding yourself with glutamate precursors. Things that look like glutamate also can stimulate the nervous system, create this overdrive and an imbalance. Most of the time, people with anxiety have GABA imbalance, so they likely are very sensitive to glutamate. What to do instead of having glutamate is to have L-glycine. I know this is all very confusing. Please do not try to do this at home where you're mixing and picking so many different supplements, increasing, decreasing. It can actually confuse your nervous system. You want to do this with supervision and assistance so that we can check your labs, your dosing, and that you don't get more panic. I'm Dr. Melissa. I'm your girl, your doctor, to talk about all things science, medical, mental health, gut health that's safe for you and your family. If you want to hear more, follow me at Dr. Melissa's Kitchen. Follow, like, subscribe, and we'll see you next time.